We'll start the meeting. Are there any disclosures of interest? Is that better? Okay. Yeah, usually. Any additions to the agenda? Marlene, is there anything else to be added to the agenda? Okay. And I'll assume that all the reports from the October 15th meeting were adopted. Nothing you want to bring to our attention? Okay, then at this point, I'm going to go right to Shanker, our Medical Officer of Health, is going to give us a verbal update. Shanker?
So, members, thank you so much for allowing me to speak today. I wanted to focus my remarks on vaccine and just maybe perhaps provide a little bit of an update on where we are with cases. So, there's lots of dialogue in the media about vaccines, and there has been one vaccine that has been approved. And I just want to share a few comments about vaccinations and vaccines. So the pipeline for vaccination has multiple steps. There's the research to identify a vaccine or a vaccine candidate, the clinical trials to demonstrate its safety and its efficacy, the regulatory process to secure approvals, the manufacture on a commercial level, the distribution from the manufacturing site to a warehouse, and then distribution from a warehouse to a site closer to the end beneficiary. Then there's the identification of clinicians to provide the immunization and an identification of which populations should get the vaccine. And then after vaccination, it's about monitoring the effect of the vaccination and ultimately also looking for adverse effects. So it's a long process for vaccination, and like a lot of public health interventions, it's just not the intervention, i.e. the vaccination alone. So we anticipate that there are already people getting the vaccine, small group of people, healthcare workers in Toronto and Ottawa. We anticipate in 2021 that some people in Haltom and Norfolk will get vaccinated. The government has already identified priority populations, which are healthcare workers, residents of congregate settings such as nursing homes and long-term care facilities and retirement homes, indigenous populations, people in rural areas. But ultimately, it's probably going to be well into 2021 when the broader community gets vaccinated. As it relates to the Pfizer vaccine, which is the one that's currently being distributed, it's a two vaccination strategy. So people get vaccinated first, and then 3 weeks later they get vaccinated again. The vaccine has high efficacy, and I have the clinical trial here that was published in the New England Journal. And they immunized about 20,000 people with the vaccine and 20,000 people with placebo. In the people who got vaccinated, there were 10 cases of COVID-19, and in the people that were not vaccinated, in the group that was not vaccinated, there was 162 cases. So that effect is pretty significant, going from 162 to 10. Word of caution, it's not 100% effective, but it's definitely more effective than placebo. With every vaccine, there's some immediate adverse events, and one might expect a pain in the arm at the site of the injection site. Some people get fevers and chills. Some people might get muscle aches. It's not an inconsequential number of people who will get those side effects. For the most part, they're manageable. But as we bring out the vaccination, I think it's worth sharing with the community. At the end of the day, we want to see the effect of vaccine, and the effect is measured by the number of cases of COVID-19 we might see. One of the core messages I'd want to share is that the vaccine is not a panacea. It is one approach to try to reduce the burden of COVID-19 in the community. But even when immunization starts and vaccination starts, it doesn't mean that we can pull back from our public health measures. Social distancing, wearing a mask, staying at home when you're sick. And So 2021 is going to be, I think, a year of getting people vaccinated from a public health point of view, but it's not a year that we can just withdraw all of our public health interventions um, uh, immediately. Secondly, when you do a clinical trial with 40,000 people, you will find side effects that are relatively rare, like things that might happen 1 in every 1,000 cases, or 1 in every 2,000 cases, or 1 in every 10,000 cases. We're now going to introduce a vaccine to millions upon millions of people. And sometimes you will find side effects that would only be present in a 1 in a million case, or 1 in 5 million case. That's just something we have to anticipate. Secondly, there will be a group of people who might have complaints or might have experienced symptoms that are completely unrelated to the vaccine, because people still get sick from other illnesses, um, and that's just something that when we do manage a vaccination program, that's something that we just have to consider. So in summary, vaccines are a good thing. I expect that the Moderna vaccine will be available in 2021 as well, so we'll have 2 types of vaccines that might be available. As it relates to the experience of the local health district, well, let me talk about the province overall. The province overall, and I always share this, no single data point is meaningful, but in its totality, we're having about 2,000 cases a day. I think yesterday's number was we had 170 people in the ICU. In early November, we had about 1,000 cases a day, and we had about 50 people in the ICU. When we go above 150 patients in the ICU, we start losing the ability as a health system to manage people with other illnesses, because as much of a burden as COVID-19 is to our culture, we also have to think of the people who get cancer and you need chemotherapy and need other treatments. And if we don't have availability of hospital resources or ICU resources because of COVID-19 cases, that's a real problem for the public health system and the healthcare system overall. As it relates to this district, we have about 760 cases in total. I think in the last 14 days we had a bit more than 70 cases. The number of cases that we've had per 100,000 people in the last 70 days, my colleague Shamir just provided me with this data. It's about 42 cases per 100,000. Our percent positivity is about 1.8%. That's the number of people who, when they go for a test, turn positive. We also had an additional death between the last time I was here to speak to you, and that was of a community residing, a person living in the community. So our death row count is now 33. 27 of those people were living in an institution. The distribution's actually 24 at the long-term care, 3 at the retirement home, and the other 6 were people living in the community. We have a continuing outbreak at a farm, and we have an outbreak at a home for intellectually challenged individuals. So we continue to bear the burden of COVID-19 in the community. The one thing I would share is that, people ask us, well, will we be advanced from orange to red to this framework of having more restrictions in the health district? So the province has promulgated a framework in November, and that framework used a number of metrics. So one of those metrics was, what are the number of cases per 100,000 people? What is the percentage positivity? What is the health system capacity to absorb additional cases? And what is the public health services capacity to respond? So as it relates to the number of cases, I think we would probably fit in the red criterion. As it relates to percentage positivity, I don't have the exact criterion sheet in front of me, but I think we are not at that point just yet. As it relates to hospital capacity, I think, in the short term, I think the hospital does have capacity. We'll will the hospital have capacity if there are 100 more admissions? I'm not sure about that. And that's something we can always have the hospital CEO comment on. And then what is our public health capacity? So what is the public health strategy? And I know I repeat myself, but this is a disease where we don't have the standard treatments in medicine, which is medications, surgery. We don't even have excellent testing. We have a test that has its flaws. So all we really have left is what we are executing on today, which is to identify, test, self-isolate. And the public health service, that has been our core focus, which has been to identify people who we think might be at risk, to test them, to self-isolate them, to monitor them. I think for today and for this past week, we've been able to hold on for capacity. Many health districts have not been able to hold on to capacity. But I am worried. You know, we've been running the office 7 days a week for these last 9 months. I'm worried about the number of cases burdening the system, the public health service contact tracing system, and I'm also worried about our staff getting burnt out. It's one thing to run the office 7 days a week for a month, but 9 months, we'll be going on 10 months in January of trying to run the office 7 days a week. So I am worried about that if we are not able to control the number of cases province-wide and locally, that we will ultimately exhaust our public health resources. At the end of the day, it's the province who makes the decision about do we advance the next stage or not. They do call me if there is that thought that they might advance, although they're not required to call. They have called us in the past. Finally, I'd leave this with you, is that every single one of you has been drafted into the front lines of the public health service. If I had to use a metaphor, you've become conscripts in a war that you didn't know about. Right? That's all we hear about for these last 9 months. There are things that people can do this holiday season that will make a difference. One of them, and this is we know from our own experience in this health district, just have Christmas dinner and your dining events with your own family. Just do that. We know that there are cases that have come about because of dining events. And it's not just the dining event. If the dining event is a challenge because people breathe on each other without a mask, but it's also the fact there's the travel associated with people coming from other places. I wish I could share what we know, but we have to protect the confidences of the people we serve. But dining events are a real problem. So I would say, as best as we can, to try to have people stay and eat dinner with their families. The second item is, if you're in any way sick, do not go to work, do not leave the house, self-isolate, get a test. And we have had people who have decided that despite the fact that they're not feeling well, go and do an activity, and that has led to cases and clusters. And so if you're sick, stay at home and get a test. Call the public health unit. And the third item is, if you can't stay 6 feet away from other people, if you can't stay 2 meters away from somebody, just to wear a mask. So those are 3 things that people in the health district can do, and each of you and all of us can advocate for this holiday season to hopefully bring this case count under control. I'm sorry if it's so long-winded, Mr. Chair, but thank you so much and I'm happy to speak. I have to run to another meeting, and I'm happy to comment on this or anything else related to the public health service now.
Shanker, it was great information. Any questions for Shanker? Councillor Corbett.
Thank you very much, and thank you for the presentation. When do you expect that this vaccine will get out to the general public in Haltom and Norfolk?
Right. So, I think I've had 2 meetings today already on the vaccine. I want definitive answers as well, but my best estimation is that it'll be the fall or the fall of 2021, or maybe even a little later, before we have the general population vaccinated. That's my guess. I think there'll be vaccination of target groups.
In the States, they're talking about general population maybe March or April getting it, but you're saying with our area, we will not get it to the fall?
Well, I'm not, so I'm going to answer that in a two-part way. I want the vaccine tomorrow, that's right, because it's a treatment, right? So it's, when will and the local health district doesn't control the procurement of the vaccine, it's the government, the federal and provincial government. But I think that from the messaging that I've been receiving, it won't be in the, like the general population will not get the vaccine until later in 2021.
And if it's successful, when would we be back to normal? Now, you're talking about the fall of 2021. If there's such a thing as normal anymore, are we talking early 2022 then?
So you've answered my question, Mr. Corbett. I'm not going to add to your comment. When, I think the first thing to think of is we'll never go back to exactly the way we were. Right? HIV changed our lives forever. I lived through that. I was a young doctor then. So do I think that this will ever go back to exactly the way we were? I don't think so. I think like a lot of public health problems, these will be manageable. So I think that we will have a greater sense of normalcy at the end of 2021 than we do now. That's my guess. And I loathe to predict the future, but that's my guess. Will there be another strain or variant of COVID-19? And so we'll have to have immunization on an annual basis. That's something that we have to consider as in the realm of possibilities. But I think that we'll probably have, with the caveat that no one is omniscient and no one can really predict the future, I think that we're likely to have greater, assuming everything goes as we hope, that we'll have a greater sense of normalcy as 2021 progresses.
Thank you. And the final question has to deal with our temporary farm workers who are stranded, and Councillor Van Passen put something forward to us with regard to the survey that's ongoing and the comments, and there's a couple of things that come up that I see that are in the purview of the health department is the number of people per unit, requests for some assistance in building and modifying the sewer type systems. What is the position of the health unit going forward on that?
Well, I think we have advocated, we sit on the AMAP, the Ministry of Agriculture panel related to housing, and I expect that that document, the document that I've been involved with, has been finalized, but not finalized and distributed. So I'm optimistic that there will be recommendations from that working group, which includes owner-operators of farms, about a strategy moving forward for 2021. The federal government has a consultation going on currently. The health district is making some comments and recommendations as well. There are a couple of realities we have to think of, just like nothing has gone back to the way it was. We have to worry about COVID-19 transmission in congregate settings. That includes long-term care homes, nursing homes, and bunkhouses or residences of agricultural workers. Many of those bunkhouses have the same risk characteristics as other congregate settings. So that's one challenge. The second is that this challenge is going to just continue with us even without COVID-19. In previous seasons, we have had outbreaks at bunkhouses related to hepatitis, to chickenpox, and chickenpox in adults can be quite severe. It can even lead to death. The fundamental public health, the item is that we have to reduce the number of people who share bathrooms and kitchens. And we are currently managing by cohorting or containment at home, meaning that when I go home, I don't wear a mask at home. I don't socially distance from my wife and kids. We use the same bathrooms. We use the same kitchens. It's contained house by house. Because if I become sick with COVID, my entire family gets put in self-isolation. So if we're dealing with migrant farm workers or any other people that live in large residences, we're going to have to restrict the number of people who share a bathroom and share a kitchen and share bedrooms. And so that, I think, has to be in some way moved forward. The second item is that if these are the directions of public policy, then what recognition is there of the operational aspects of pulling that forward? Because how do you build more space, and how do you make that time efficient? Those are entirely fair questions. That's not entirely for the Public Health Service, because planning and bylaw and a lot of other agencies are involved with that. The analogy I would give is that COVID's affected everybody. College dormitories. What's happened, and this has happened to every family that has a child in university or college. Well, first of all, a lot of people don't want to send their kids back to the college. I don't want to. My son is with me. He's studying virtually. Secondly, if they do go back to college, they're going back to dormitories that are de-intensified. So instead of having 20 kids on a floor and having 2 or 3 kids in a room, they're now moving to private rooms. They're reducing the number of young people sharing bathrooms. They're shortening the semester, so they're living shorter periods in congregate living. So those principles, I think, and universities and colleges, if they want to have more students, are probably going to have to build more dormitory space if they want the child. That's my guess for universities and colleges. So for farms, I think they're going to be in that struggle as well. How do they build in a time-efficient way that keeps the workers as safe as possible? Recognizing also that they suffer from some of the greatest human and financial impacts of an outbreak. If there's an outbreak at a farm, we have people that are sick. We had an outbreak where we had 200 farm workers get infected, but there were another 20 people, approximately 20 people, who lived off the farm and got infected. 18 people went to the hospital, 12 were admitted, 7 went to the intensive care unit, 2 went on a ventilator, and 1 died. So a farm outbreak is a significant public health concern, and we have 4,000 migrant workers in this district. And also that meant that farm operation was really not able to function as an enterprise, which has impacts to the society overall. So given that, I am supportive. I personally am supportive of trying to expedite the provision of proper housing for farm workers. I'm sorry I'm so long-winded on it, Mr. Corbett, but we are advocating in every way, in an apolitical manner, to try to bring this under better control.
Trying to understanding the input from this, I understand that they want a response, and it's a survey by December 22nd. You put your input into the government, or you respond to their survey, and then you take your position from there with this group? How does that mechanism of responding and getting your message to the people who are making the decisions?
So I have no expert knowledge on the functioning of the federal government itself. However, notwithstanding that, I have spoken to the senior officials, both on electronic and on the telephone, on what our recommendations are. We're also going to write and put that in writing as well. The Board of Health chair and I joined in a conference call with the people formulating the report. So, and others, including advocates for migrant farm workers, other health districts, owners and operators of agricultural enterprise have all placed their input. I think the federal government will consider all of that in formulating their final guidelines. There are certain items that are granular that have already been described. I think and I don't have that document in front of me, but I think it's a public document. I can share it with you. But I think the federal government's initial position, or at least in the document, that articulated restricting the number of people sharing a bedroom, I think, to 4. So, I think that they're bringing granular level responses to try to help advance this discussion.
Thank you, Mr. Chairman.
Councillor Taylor.
Thank you, Chair Dalmontaine, through you. Going back to the vaccines, I believe it's the Pfizer vaccine that has to be kept incredibly cold. Do we have the capacity in Haldeman, Norfolk, not only to transport it, but to store it for distribution?
So perhaps I could ask Ms. Miranda to comment on that, because she knows those operational details.
Yeah. So through the chair, we currently at the health unit do not have a Pfizer compatible freezer. I do understand that our hospital is trying to procure one to have one available. As related to distribution, the vaccine is not to be transported because there are challenges with that. So once it lands in a fridge, it needs to be distributed. So initially, the immunization will have to have people come to the institutions that's providing it. But the hospital is working on a plan to have the vaccine available if it should become available for Haldeman and Norfolk.
Mr. Patterson.
Thank you. And through you, just a general question, Shanker. Going back to when you read the news, everybody's aware that there's more cases in this phase than there was in the first phase. I'm just wondering, has there been any discussions in the background through the health board as far as, and I apologize, I can't remember the official name, but the temporary emergency shelters that were set up in Port Dover and Dunnville that weren't needed in the first phase? Has there been any discussion if we need to implement that, or if there has been discussion, how quickly that could be done?
Yeah, maybe Marlene can supplement my answer, but I could share this, that when we, at the beginning of the pandemic, we were projecting hundreds of hospital admissions, and mobile hospitals or a pop-up hospital or pop-up freestanding treatment centers were part of the plan. It's part of the U.S. It has been part of the pandemic plan in other locales. So we were able to roll that out quickly, and I think that if that became an option again, we now have sufficient operational and content knowledge that we could roll it out quickly. First time around is always hard. So I think that still remains an item that's available to Haldeman and Norfolk counties if it came to that situation. As it relates to the Board of, and maybe Marlene can just supplement that, but I don't think the Board of Health as of today had that discussion about should they open one up now or not. I think that through the emergency operations group, if we got signals, and it's always hard to predict the future, so we're a little cautious about this, but if through the emergency operation process we found out, or we had signals that we were going to saturate resources, be that on the inpatient side or the outpatient side, then I think we would revisit reopening those centers, and I think we could probably do it quickly because we already have the experience of doing it once before.
Marlene, do you want to add anything?
So thank you, Mr. Chairman. I think I'll just supplement that with is that the EOCs continue to meet in both counties, and we will be able to mobilize fairly quickly in the event that there's indicators to suggest that we should implement the ICCs again. We are working with our hospital partners. Our hospital partners over the last months have increased some of their surge capacity. However, if they find themselves in that situation, they'll work with us and we'll proceed as required. And like I said, we have things all stored in storage containers, and we would just have to melt the ice, and we would be able to mobilize it probably within a few days, if not a week or so. But we'll watch all the indicators of hospital capacity. We'll bring it back to the EOCs for their support, and to the board and to the respective councils as required.
Okay, thank you. Councillor Van Passen.
Thank you, Mr. Chairman. I think the plan is we have two shipping containers. We don't have to melt the ice because we have the rec center ice pad doesn't have ice in it, and that is the backup plan. And we've also kept the Victoria Community Center is not being used. That is a backup just if we needed a vaccination center or something like that. It's all, the staff has been very good having a backup plan A, B, C, D, E, F, G, and hope they continue on, and I hope we never use any of it. So.
Would that include the residents from Haldeman County as well?
So we have backup plans for immunization and testing, and anything we do in the health unit is covers both counties, and we've been working with both counties on that. We have a little bit farther advancement as far as assessment and testing and vaccination centers in Norfolk County, but we'll work with our Haldeman partners and secure that space as well. So yes, it is for both counties respectfully.
I have one question, then I have Councillor Huffman, and I'm not sure whether Shanker or Martin would be best to answer this question. But Shanker, you've made reference a couple of meetings now to the issue of staff burnout and the pressure on staff and operating 7 days a week. In my mind, I have an idea of what's going on here, but I can't grasp it wholly. And I wondered if you could just give me a short synopsis here of who is involved with that. Like how many staff are we talking? What are they doing on Saturday and Sunday? And I understand you just say that you've been doing this for almost 10 months now, and you see it continuing with the number of cases increasing. Can somebody just, either one of you, give me a flavor of exactly what you're talking about there?
Sure. So I can sort of give a clinical example, and then Marlene can sort of supplement that with the resources that might. So we now, in Ontario, every time a person has a disease of public health significance, laboratory test, the results go to the public health unit. And we are, during the day, surveying the computer system, and right up till, I think, 10 o'clock at night, we're surveying the computer system, interrogating it to see if there are people who test positive. If somebody tests positive, I'm going to use Mr. Van Passen as the example. He tests positive, and we would call him. And someone would call him and ask him, tell us about your exposure. And if Mr. Van Passen would indulge me, he would say, oh, I had dinner with my wife and my 3 grandchildren and my son-in-law. Let's say that was the story. Then we would say, okay, let's find out about the symptoms of each of those people. And we would start a self-isolation plan based on who the close contacts might be. And Mr. Van Passen might say, oh, and I also visited somebody else, or I went to my workplace. So one phone call could identify a case. It would require a management plan for the Van Passen household. It's always done without judgment. Right? We just want people to tell us, it's just like for sexually transmitted illnesses or anything else, we just want the information. It could create a public health plan. So that one case could mean that we would make dozens of phone calls. And those phone calls would be to the people who are close contacts, identifying them, investigating them. If it's a long-term care, if it's a group home or a group residence, it could mean also the administrator of the residence. It could mean, on occasion, the regulator. So one case triggers a whole cascade of phone calls and investigations. And then after people are placed on self-isolation, then we have to call them on a regular basis to make sure they're compliant with it. The vast majority of people are compliant with it, but every so often you have to send somebody a Section 22 order. If we have to send a Section 22 order, then we have to draft the order, have legal counsel, in some cases, review it, and then we have to deliver it, and then we put them on a more intense monitoring plan. So if it's one case, we can manage it. If it's 3 or 4 cases a day, we can. If it's 40, we'll be challenged by it. So with that, that's sort of the clinical scenario of just managing one case. Now in a farm, we may end up getting 100, like in the farm we had 200 cases, and they all came out quickly. And that creates another group of logistical challenges. So, but maybe Marlene can talk about the human resource allocation for that.
So through the chair, we have most of our public health staff that have been redirected to work on COVID activities, as Dr. Nisa Thury has articulated for us. We've divided the team into multiple teams, and we have different teams working on different days doing that work. So the teams are working 7 days a week doing case management, contact tracing, follow-up, outbreak management, and we do try to focus on the weekends on the clinical aspects of it to our community and focus more and have more staff Monday to Friday, following up with changes in ministry directives. Now we're working on rapid testing follow-up planning. We're working on mass vaccination planning. So the directives from the province has been fairly consistent, and we continue to work through that, working with all of our system partners. As you can appreciate, this isn't just a local event. This is a regional, provincial, and national event. We are also working, because of our migrant farm worker population, there's a lot of activities going on advocacy for the migrant farm workers and advocacy to get the guidelines for the farmers so that they can move forward into the 2021 growing season. So there's a lot of planning and a lot of activities related to all of those things that have transpired over the last 9 months and continue to change because it's ever changing as we move forward with the pandemic. So I hope that answers your questions. I don't know if Stephanie wanted to complement that. She's our operational lead and works deeply in the schedule on a regular basis, which is challenging in itself. So with that, I'll leave it at that.
Thank you. Councillor Huffman.
Thank you, Chair Del Monte. Through you to Councillor Van Passen, I just wanted to follow up on the one comment that you made. You said about the Victoria Community Hall being used for immunizations.
I said it's been held in reserve. They're not booking it just in case the opportunity comes along that we could have, like even for the regular flu vaccines, but they were just sort of holding that one in reserve just in case.
Okay, because I was just going to say my understanding was that the vaccine couldn't be transported once. Okay, Marlene?
So through the chair to Councillor Huffman, we have put specifically the Victoria Centre on standby, and it is actually equipped and ready to go if we had to do outbreak management. So if we had a significant school cohort, for example, we could have parents drive by and have an assessment with our EMS assessment center with our EMS team and our hospital partners. So we've set it up for two different possibilities. That's one of them. The second one being if and when we're prepared to mobilize the vaccine, then that could be used as a clinic center as well, and it's set up for that now as well, and it's on standby as Councillor Van Passen has already advised. So you are correct, the Pfizer can't be distributed. They are looking with Pfizer globally on, transporting that in different ways, so it could potentially at some point in time be transported further, but they're also working on the Moderna vaccine, and the Moderna is more transportable, is only required to be at -20. We have freezers coming for that locally that'll be able to accommodate that, and that would be a vaccine that we would transport to different clinics, long-term care homes, potentially farms, wherever it needed to be, and that we would be vaccinating. So yes, that center is specifically being held on reserve so that we could quickly mobilize in the event of primarily an outbreak right now, but as we move into vaccination clinics and then hopefully in the very near future.
Shanker, I see no other hands, so I know you have to run off to another meeting. Thanks. Thank you.
Thanks for having me.
Okay. We'll go back to item 6.1. Marlene, I understand you have an update for us.
Thank you, Mr. Chairman. I apologize. I thought you were asking for agenda items when my mic wasn't working. I just wanted to give you a few updates and the advisory committee on the special Board of Health meeting. So on, I think it was October the 27th, we had a special Board of Health meeting, which a couple of reports were not circulated to advisory. So just for follow-up to that, report 2021, the COVID update and sustainability plan with the additional information that had been requested by both respective council Councils and the Board of Health. That report was carried with the approval of 17.2 FTEs and the approval of the EMR to support the COVID response. Also at that special Board of Health meeting, just because of time sensitivity, report HSS 2019, the Ontario Seniors Dental Capital Funding, which was a budget amendment, was also carried, and just to advise the committee, there was no levy impact to that report. Board of Health on November the 3rd, which was a follow-up or a planned meeting from the advisory of October the 15th, all reports were carried as presented. A couple of other items, if I may. The Haldeman Norfolk Housing Corporation shareholders did have a meeting on November the 26th where a shareholder agreement was in the resolution, and both county clerks will be bringing that forward at their respective councils, so they're working through those resolutions. And finally, if the last item is on our agenda, the operating budget was to be discussed today. We were unable to have it prepared for today, so the printed copies will be circulating in the next few days. Our finance team is working very diligently trying to get that out to council. So I am seeking guidance from the advisory committee to meet at your discretion, whether it be a couple of suggestions to have a special advisory meeting either sometime next week, and I do appreciate that this is the holiday season and that could be difficult, and or on January the 5th, which will be the day prior to the Norfolk County budget deliberations. And with that, I will turn it over to you, Mr. Chairman.
Marlene, what's the feeling of the committee? Councillor Corbett? I think for me, next week is out of the question. I'd be looking to January the 5th. I know that there's been a desire from Haldeman Council that the three of us participate in a review of the budget before it goes to Norfolk Council. So I'll look to you folks for comments. What's your pleasure? Councillor Corbett?
I realize it's going to be a compressed time, but I've got nothing more to do with my time than look after this. Question I had, the recent announcement come out yesterday that there's more funding being put into this COVID problem that we're having for municipalities. Is any of it going to wash down to assist with the COVID and the health unit area?
So through the chairman, the finance team and public health have put in a substantive extraordinary cost to offset the cost of the COVID. We haven't had that funding announcement provided to us. I did send out an email earlier this week to the ministry, and I did get a response that it's in its final stages of approval, and hopefully we should hear what our share of those extraordinary costs will be in the very near future. So we will circulate that out once we receive that funding.
Marlene, how soon can you get that budget document out to members of the committee, particularly Haldeman?
So through you, Mr. Chairman, I understand that it's going to be electronically shared tomorrow evening and then circulated out to council. So I will follow up. You should have it early next week, which I know is a really tight turnaround time. So that does present a challenge, clearly.
Okay, so unless I hear any objections, I'm going to go with January the 5th as a special meeting of the advisory committee. Does anyone have any objections to that? And I guess I should add, so I'm gonna add this in now. I was gonna raise it later on in the agenda, but I'm also looking at, for the future advisory committee meetings, starting them at 9:30 in the morning. I just hate this 1 o'clock start. I think it chops the day up terribly. And so I'd be looking to have this budget meeting at 9:30 in the morning as well. And I'm wondering, I'd like to have some feedback on that as well. I've already spoken to Bernie, but I'll let Bernie and Councillor Patterson, but I'll let you folks throw in your 2 cents on that one as well. But first of all, let's deal with the budget meeting. January. Hassan?
We have our regular meeting at 2 p.m. in the afternoon that day, so 9:30 in the morning on January the 5th would work. So.
Kristen, can we get an meeting invitation out on that? Okay, and the Haldeman councilors will get the document, and it gives us time to speak to finance staff at Haldeman as well. Shall we leave the meeting start date for until later on the agenda? We'll discuss it later on. Why don't we do that? Mr. Corbett?
Have you moved on to speaking about the starting date or starting time? Because I'm very much in favor of starting at 9:30. Starting at 1 o'clock completely ruins my day. It takes me roughly an hour to get here, and my day's gone. So I prefer to start at 9:30 if that were agreeable to the members. I don't know in terms of staff.
I'm going to deal with it later in the agenda, Bernie, and we'll talk about the vice chair as well. We'll deal with it later in the agenda. Okay. Reports then on page 7. We have staff report HSS 2026 regarding Public Health Agency of Canada funding grant for harm reduction surveillance. Who's going to speak to this report? Shamir? Shamir, can you put your mic on?
Okay. Sorry about that. I don't have to restart, do I? All right. So in August 2020, the Health Unit submitted a proposal to PHAC for a time-limited one-time funding grant to implement or evaluate the surveillance of fatal and non-fatal drug-related harms. In November, we were notified by PHAC that we had been awarded a one-time funding grant of $80,000. This grant will be used to adapt and implement a surveillance tool that will provide a centralized reporting platform for substance use activities. The platform would convey real-time data and enable the health unit staff respond in a timely manner to any changes in the substance use activities. The surveillance tool under consideration for adaptation is the fast overdose alert system that was developed and is currently being used by Wellington Dufferin Guelph Public Health Unit. FAST means FAST stands for is flexible, accessible, scalable, and timely. The grant that has been awarded will cover the cost of a 0.6 FTE temporary part-time staff to coordinate this project, and it will run for 17 months from November 2020 to March 2022. No additional funds are required from the Board of Health for this project. In conclusion, it's recommended that the board accept the one-time funding of $80,000 from PHAC to support the adaptation and implementation of a surveillance tool to track substance use activities, and also that the board approve the recruitment of a 0.6 FTE temporary part-time staff to implement this project. With this, I'll be happy to answer any questions members of the board may have.
Any questions of staff on the report? No? For the motion on page 9 of the agenda, I think that's supposed to be received for information. Mover and seconder, Councillor Corbett's moved, seconder, Councillor Patterson. All those in favor? Sorry, questions? Councillor Taylor?
Are you looking for approval today, or just perceive this as decision and this is going forward?
We're looking for approval and acceptance. So our ask is that the Board of Health accepts the one-time funding.
Okay.
And then the decision to recruit 0.6 FTE temporary full-time.
Okay, so I think we
Temporary
need to
part-time
rejig
staff.
that motion slightly to,
I'll ask the question to staff then again, before I'm going to call the vote again. Is it for decision or is it for information?
So if I may, I think we do need to adjust the resolution, if I could, to receive as information, to accept the one-time funding, and to approve the FTE request as well. So if we could have that maybe by Kristen reworded and for your consideration, that would be appreciated. Thank you.
And we have a mover and seconder. So all those in favor of that motion? It is carried unanimously. Thank you, Councillor Taylor. Okay, so we'll move on to page 10, which is the Halton Norfolk Housing Corporation Regeneration Master Plan Update and Asset Classification. Matt is here and Heidi.
Yeah. So thank you, Mr. Chairman. We'll just wait for a few minutes for COVID protocol, and Ms. Van Dyke and Mr. Bowen will join us.
So Heidi, Matt, when you're ready, the floor is yours.
Great. Thank you, Mr. Chair. Through you to members of committee, everyone has had the opportunity to meet Mr. Matt Bowen, the CEO of the Halton Norfolk Housing Corporation. I am going to present the staff report, and then Matt and I will be happy to answer any questions. I can answer any questions about the regeneration process or the role of the service manager. Matt is happy to answer any of the technical questions on the consultant's asset classification report. So the purpose of this report is to provide committee with an update on the regeneration and asset management planning process. and specifically to present the consultant's report regarding asset classification, which is an important step in the process and will inform the next parts of the planning process and future revitalization, redevelopment, or disposal of existing assets. So regeneration of social housing stock can mean different things. In general, it means that we are looking at the existing housing stock, some of which was built up to 50 years ago, to determine whether or not it has outlived its usefulness, whether it still has retained its value, and whether it meets the community need. And it allows us to look at some opportunities for new development in order to ensure that we maintain community housing stock that is in good repair, that is responsive to the community need, and that is modern, and also is good environmentally for the community. So what has happened is that Matt has been working with the consultants. I have been involved with that process as well. The consultants were retained through an RFP process, and it's Herco Inc. They are preparing plans that will guide the Housing Corporation over the next 15 years in their decision-making and resource allocation related to capital repairs, redevelopment of existing assets, and undertaking new affordable housing development. The final plans are scheduled to be completed and presented in the spring. So in March 2021, those plans will come to the advisory committee and then to each council. So the asset classification process involved evaluating each of the existing social housing buildings against a set of 45 criteria to rate the asset as one that should either be retained, meaning that we would keep it as is and keep it in good repair, revitalized, meaning that it is worthy of keeping but may need some significant capital repairs or makeover in order to have it retain its value. Redevelop, which means that we would keep it but potentially turn it into something different or do a significant redevelopment of it. Or if it is an asset that we consider should be disposed of. So an asset that no longer meets the community need, is not in a good state of repair, would need significant capital investment, and that quite frankly has greater value if we were to either tear it down and build something new, or if we were to sell it and use the proceeds to build new affordable housing. The latter is what we refer to as, quote, leveraging the assets. So you may have heard discussion about leveraging assets. That's what we mean by that. The Housing Corporation senior management then took the ratings of the consultants and they applied additional value-added criteria, including things like energy efficiency and alignment with the corporation's strategic plan. So the consultant's report is attached to the staff report. I have reviewed the consultant's report. I participated in the board meeting where this was considered and approved by the Haldeman-Norfolk Housing Corporation Board, and I am recommending acceptance of the consultant's report and acceptance of the classifications of the assets, and that this information be used to complete the regeneration and strategic asset management plan. On page 2 of the staff report, I just noted some information about service manager consent, and this is something that will come forward again when there are proposals for new development that involve either the tearing down or selling of existing social housing assets. It is a legislative requirement under the Housing Services Act that if existing social housing buildings are demolished and there's a rebuild, or if they're sold and the proceeds are used for redevelopment, There is a process that we need to go through locally to ensure that tenants are communicated with properly, that the tenants are not displaced, and that all proceeds of sale are reinvested into new community housing. At the staff level, I would do an analysis of the business case that was being put forward, and I would present through advisory committee to councils the recommendation whether or not to give service manager consent, and then that decision would then be reported to the Ministry of Municipal Affairs and Housing. You can see under the consultation section of the report, pages 3 and 4, that this report in draft was circulated to Matt and his team, and he has provided comments in support of the staff report and the asset classifications. So with that, we would be happy to answer any questions.
Okay, thank you, Heidi. Questions to Heidi, Councillor Corbett?
Thank you very much. I certainly support this. I would ask, we're not breaking a new trail with regard to the process. It's been done by others in the housing field. What's the results been? How successful have they been? And just a comment, I see this as doing our due diligence to deal with some of the rundown property and how we could leverage it to get new.
Thank you, Mr. Chair. Through you to Councillor Corbett. Yes, regeneration of existing social housing stock has been happening across the province for years. Various communities are at various levels of regeneration. We are obviously at the very beginning stages, and that's okay. We're there now, so we're moving forward with it. But we're also, one of the things that often triggers regeneration is the payout of mortgages. And so not just with the Housing Corporation, but with our other nonprofit community housing providers, our social housing mortgages are starting to be paid off, which gives more opportunity to leverage those assets. And so that's one of the reasons why we're a little bit later in the regeneration process, but also, you know, Matt and his team has made this a priority to get this work done and to move it forward. So, and I really appreciate the work that Matt's done, the consultants done, the board has done, and the staff at HNHC to keep this moving. And in terms of results, you know, there are really creative things that we can do in terms of building new housing, including partnerships. And I know Matt's been working on developing partnerships with community partners to increase the number of supportive housing units that we have. We can do mixed income communities where we have some units at market level rent so that those higher rents offset the subsidies for the more traditional rent geared to income. So it really does give us more options, and the province supports that. That's when I first started, the service manager consent decisions rested with the ministry, and everything had to go to the ministry for consent. And the province realized that these decisions are best made at the local level, and as long as we do our due diligence, we're fine.
That's the thing I wanted to make sure. This is part of the due diligence that this committee has to do going forward.
Yes, Mr. Chair, through you to Councillor Corbett, I would concur with that statement.
Councillor Patterson next, and then Councillor Huffman.
Thanks. And through the chair, I'm definitely in favor of this proposal. I just have a specific question, and I'm going to let Heidi off the hot seat because I figure Matt's not here just for his good looks. He can, you know, answer a question. But it's on page 4 of 5 of the report, and is to do with the 5 principles. I'm just wondering, I'm reading through number 2, and when they have anticipated repair expenses in excess of $10,000, I guess my question is is that figure set in stone or is it flexible? Because, I mean, I'm just thinking out loud, you could have a good piece of property and it would cost 10,000, if not more, to replace the windows. So do you have a bit of leeway in that to make it like a discretionary call?
Through you, Mr. Chairman, Councillor, there is, and the logic behind that is, specifically in properties that would sort of already meet that disposal category. So let's use, for instance, a single or semi home that currently exists. So if it currently was through the asset classification analysis model as a property we'd want to dispose, then we wouldn't want to, put that $10,000 into that property specifically. But there are many other properties, that would not be in that category that we would still, from time to time. That's sort of the threshold. That $10,000 mark is, a number that we pay close attention to in terms of, what that repair would look like. So to your question, there would be flexibility, and specifically that number speaks to the disposal classification. So we wouldn't want to put that money into a property essentially that we'd be selling and maybe not get that back out.
Councillor Hoffman, then Councillor Taylor.
Thank you, Chair Del Monte. Through you to either Matt or Heidi. So again, I thought Stu was going to ask my question there because I'm on page 4 and looking at the 5 principles here. Number 3, units which can be purchased by current tenants. How often does that happen?
So I can take a shot at that. Thank you, Mr. Chair, through you to Councillor Huffman. Certainly that would be an avenue that we would look at if there were units that we were looking to dispose of that were occupied. So our first plan would be to dispose of units through attrition or as they become vacant. And in fact, there are some units where currently I have let Matt and his team know that because we're in the middle of a regeneration plan, we have a date when it's coming to council. Let's leave the units vacant for a couple of months if they're on the to dispose list, so that we're not displacing anyone. But if there were units that were occupied, it would be my hope that one of the strategies that council would choose would be to give the existing tenants first right to purchase their unit. And in our department, through our provincial affordable housing funding, we have a program called the Affordable Home Ownership Program, where we can, as a forgivable loan, give a low-income first-time home buyer an interest-free forgivable loan of up to 10% of the purchase price that they can use for their down payment. And it has a 20-year period. So if the person stays in their home for 20 years, at the end of 20 years, the money is forgiven and it's considered a grant. If they sell the home within that 20 years, they have to, from the proceeds of the sale of the home, they pay back the loan and 10% of the capital gains. And we take that money and we put it into a fund to reinvest into the program to assist other first-time home buyers. So because of that, particularly if we have tenants who have a more stable source of income, maybe even if they're minimum wage earners or lower income employed individuals, there is a possibility that they could qualify for down payment assistance and be able to purchase their unit, and then they would be a homeowner. Mm-hmm.
Councillor Taylor.
Thank you, and through you, might be a little bit early for this question, but do you have a rough figure of what you anticipate or how much of the redevelopment and revitalization costs should be covered by the disposal revenue generated? Are you aiming for a particular figure?
Through you, Mr. Chairman, to Councillor Taylor, we don't have that exact number yet, but our goal is to bring to council, a balanced plan where, we're matching potentially municipal contribution with the assets that we currently have. So we recognize some of the pressures that both councils face. So our goal is to work with each finance department in addition to Heidi, so that we can bring the best business cases forward where we're optimizing those lands. So as Heidi mentioned, our goal is by the end of March, early April, to have this planning done, at which time we'll bring that back so we have, considerable input to make sure that, we're making the best decision.
And if I could just add to that, that number is also a moving target based on the real estate market, because if we were selling property, that we would have the properties appraised at, and they would be sold at the market of the day, right?
Sorry, if I could just add to that, Mr. Chairman, we have, done 2 fair market value assessments, and they are changing. Just to sort of back up what Heidi's saying, I had one study done when I first joined, and a year later, we had them reevaluated, and, those numbers do change. They are fluid.
And further to that, do we use internal realty services for a lot of this, or do we heavily rely on external services?
I can answer that through you, Mr. Chairman. What we'll do is it will be a competitive process. So we worked with an individual realtor to sort of do a market value assessment. We used a local realtor here in Norfolk and one in Haldeman, just to sort of look at a couple of the properties and give us a broad range. But when we move into the disposal area, we will, through competitive process, put an RFP out to secure a realtor.
All right, thank you. I'm trying to tease out another question here, but let's go on.
Matt, and then I've got Councillor Van Passen. Matt, I read this report when you brought it to Haldeman Council. I spent so much time dealing with roadblocks the last couple of weeks that I meant to go back and read this again before today, so all I had an opportunity to do is scan over it. So in Dunnville here, where we've got a really high demand, you should be able at the end of the day here, generally speaking, substantially increase the number of units that we can offer, that the Housing Corporation can offer in the community of Dunnville. Generally speaking.
Through you, Mr. Chairman, to you, Mr. Chairman. That's a difficult question to answer. I think the answer lies in the ability to continue to work with great leadership like Craig Manley and Kathy Case to really determine. I think the possibilities, whether it's sale of home ownership through residence or intensification, they're not endless, because there are significant costs to new development. But I think what we have here is an opportunity to work with each municipality and determine what the need is, and then make sure we maximize the opportunity. That's what I don't want to miss in this exercise, is making sure that we're building the right housing in the right places, with the right amount of units.
Because that's certainly what the public is going to be looking for in that end of Haldeman. And if we can throw in any type of commercial development that generates revenue, all the better. Helps us sustain the whole project. So part of that could include vacant land in Dunnville as well.
Through you, Mr.
Buying
Chairman.
vacant land and brand new facility.
Yeah, so we're working, as you know, closely with both counties, but specifically with Haldeman County and Norfolk County around the transfer surplus land. So that certainly plays a viable piece to the puzzle. It helps us with municipal contribution and co-investment funding and other incentives. So ideally, it makes sense when we can work with the municipality to identify surplus lands and then potentially build there. It's a bit of a win-win in terms of the municipal contribution to the project. So yeah, absolutely, that the land does play a critical piece.
Okay. Thank you. I have Councillor Van Passen.
Yes, thank you, Mr. Chairman. Yeah, the new guy gets asked a stupid question, so I'll start on him. I read through the report, and you're looking at your assets and the best use of the assets, but have we stood back and looked at it from the lens of, like, let's say I was a private sector developer looking at the total sort of package we have and say, where do we have locations that, the real market value is disproportionately gone up because of changes in the neighborhood or the changes in zoning, and there's, space to do a redevelopment, and, have we stepped back and looked and said, you know what, maybe we just sell that property because we can turn a heck of a profit on and use that to build instead of 1-to-1, that you rebuild 2-to-1 or 3-to-1 or 4-to-1. And how is that process? Like, is it, you got to go build the replacement first and then put the one on the market so that you don't displace people? have we looked at it from that point of view and not just, there's, generally I see always a trend in government to stay in your silo, you never look outside of it, but I'm hoping that we've done it from all sides.
So, Mr. Chair, I can speak to that through you to Councillor Van Passen. When the Housing Corporation brings forward a business case for a new development, part of that business case needs to include a plan for the tenants. So one option is that we can do it through attrition and wait. One option is that we can say, okay, how can we support the tenants elsewhere in affordable housing? So we can have affordable housing units that are earmarked as affordable housing units because they're traditional social housing. We can also create affordable housing units in the private market by giving people a housing allowance or a portable housing benefit to top up the difference between what they can pay and the market rent. And we can, there's been a change in the provincial regulations that we can apply to the province to say, okay, we've created, with a rent subsidy, we've created 5 units over here. So these 5 tenants that are living in these places that we want to sell so that we can build, we're going to rehouse them over here and in units that they've chosen, but we're providing them a rent subsidy so that they're not losing their affordable housing because we want to sell the units and build something new. So those options will come forward as part of the business case for council to consider and decide. So it doesn't have to be a waiting game. It can also be part of the business case has to deal with financing so that we know that it's a financially viable project. So perhaps it's that the Housing Corporation is proposing to finance more of it through mortgage or debt, and then use the sale of proceeds of sale to pay off that mortgage over time. It just depends on what the specific plan looks like for the development that we want to put forward. What this report does is that it attaches a classification to each asset so that we have in our minds what units we think should be considered for disposal that we could leverage as part of a business case for a new development.
What I'm trying to tap dance very politely around is, let's assess what we own. It doesn't need major repairs. It's well occupied, good amenities, great location. But then somebody else would step back and say, you know what, that location of that house, we can get $1 million for that house, and with that $1 million, we can build a 4-unit townhouse somewhere else. Even though it meets all the criteria and it does all that, it might be worth selling it just because the sheer market influences and the way real estate is right now, even though it fits the plan and it fits the criteria to stay. Can we just step back and look and say, you know what, as a business, I would sell it and build something and, get 2 and 3 and 4 times the use out of the same dollars. And that's what I'm wondering whether we've looked at.
So go ahead, Matt. Yep.
Through you, Mr. Chairman, to you, Councillor, part of the process in the end will be some of those recommendations. And I think maybe you might be alluding a little bit to, and I don't want to put words in your mouth, into like a 3P or a private-public partnership of land. So what we're doing, and a good example sort of what you're saying is, if we utilize the singles and semis, for instance, that, that could be available, if we leverage or sell those, a few of those to earn a few $1 million, we take that few $1 million to build something new. And that is built into the plan, absolutely. If we're talking about a larger scale apartment building, most likely not. As Heidi mentioned, there's a lot of complications in relocating that many folks, especially in an occupied building. And for us, our model has really been about that mixed use, mixed income, multiple layers of income, with some commercial added value. So, you know, when we look at the sale of the singles and semis, for instance, we can generate a lot of cash flow, which would contribute to the development of a whole new project that would sustain us for the next 40, 50 years. That's certainly a part of the plan.
I think, though, Mr. Chair, in addition to that, if there was a property that was on the list that to keep, but council decided was incredibly valuable and could fund another development, provided that the criteria in the Housing Services Act are met for service manager consent, my suggestion would be that it could be done. It would not be in keeping with the recommendations that, you know, the consultants have done as part of their asset classification evaluation. But when we're looking, the legislation is very clear about the requirements that need to be met to give service manager consent. And, you know, if the question is technically, could we dispose of something that's being recommended that we keep? My answer would be, if it's part of a plan and the legislative requirements are met around taking care of the tenants and reinvesting all of the money into new affordable housing and maintaining our service level standards, yes, that could be considered.
Councillor Corbett?
Thank you very much. I very much understand what you're saying, and my idea would to leverage the assets we got, sell these property, go ahead and build, and as we sell, pay off the debt. But there's one rider that we have to look at. You have to accommodate some of the people that are there, so it's a balancing act. And when we look at the opportunities that are coming now, houses that were 3 years ago in Dunville, 150,000 are going for 300,000. I'm sure you know what the Toronto market bringing us, and the average house is being sold for 450,000 in Dunville. When I look at one particular subdivision now, which is the subdivision that we got for sale, is some of these houses can be sold off at a reasonable price that we can call it's affordable for some people. So we accomplished something at Elizabeth Crescent. These houses are not major houses. They need some repair. They're dated, but some people can come in and pick it up for a lower price. And that's what I see a benefit in that, and utilizing that to go with the plan we got in Haldeman as a 4-unit building to do what you want. We're rezoning some property recently to accommodate that type of thing. There's no vacant lots in Dunville. We have to do something. We're trying. So that's our attempt to do it. So what you're saying, yes, it'd be great to capture the market now, sell those houses. I don't know if Matt's got his figures on it. He's looking at 400,000 for Elizabeth Crescent. I don't know. Maybe you get into a bidding market that's below what the average is, and it's a decent starter home for some people. So, and we accomplish what we want. We get new housing that we can look after, that's ecologically good for the country, because we're saving money on lights and all that type of stuff. They get a nice new home. There's other things that are associated with that we would benefit by it as well. So looking at what you're saying, we can accomplish that.
Okay, any other questions, comments? Okay, Heidi, thanks very much for the report, and Matt, thanks very much for all the work that you've done here. I really look forward to seeing the further reports you're going to bring forward to both councils. I can't wait to get going on this. So I'm going to ask for a mover and seconder for the motion on page 14 of the agenda. Councillor Taylor's moved, Councillor Corbett has seconded. All those in favor of that motion? It is carried unanimously. So That brings us over to page 36, staff report HSS 2024 regarding homelessness prevention services, emergency housing program. Heidi?
Thank you, Mr. Chair. Through you to members of committee. So this is the follow-up report that came from the last advisory committee where we had some questions and discussion about the emergency housing program. And just to follow up with committee as well, I did speak with the neighbor of the emergency housing program and heard her concerns. And we talked about some of the safety upgrades that we are looking at the emergency housing program location in Jarvis. Currently, our emergency, so as council is aware, our homeless prevention services are delivered by the team that is within the Social Services and Housing Department. The emergency housing program is one program within that. We also deliver housing with related supports, homeless prevention services, such as the Housing Stability Bank, and housing support services. The emergency housing program is specifically the subject of this report. All of our homeless prevention services are delivered using a housing first and trauma-informed care approach. So housing first, in a nutshell, means that we work from a philosophy where housing is a basic human right, and that people have the right to have housing with no strings attached. We house people first, and then we identify and wrap the services around them that they need in order to remain housed. That's similar to what I was referring to at the last committee as a low barrier program. So we don't require people to commit to abstaining from alcohol and drugs. We don't require people to, do X, Y, and Z in order to come into the program. We're willing to meet people where they are at, recognizing that some may have challenging behaviors due to their life circumstances and vulnerabilities. And then we work with them to stabilize their housing situation first, and then wrap the services around them to further stabilize their life. Trauma-informed care means that we recognize that being homeless in and of itself is a traumatic event that impacts people's behavior. We also recognize that many of the people that we support who are homeless or who are experiencing housing instability have in and throughout their lifetime experienced other forms of trauma, such as violence, such as abuse, racism, multi-generational poverty, and that trauma has also impacted their life choices and their behavior. And so recognizing that link between the trauma, the homelessness, and some of the challenging behaviors that we sometimes see with people helps us to be able to work with people in that low barrier kind of way, in a way that is non-judgmental and supportive and empathetic, and helps them to move along the housing continuum. The opposite of that would be that that doesn't mean to say that we don't have rules. We do have rules in the emergency housing program. People cannot be violent towards themselves or other people. They can't have other people staying in their rooms in the emergency housing program. And if their behavior is such that it has the potential to cause harm to themselves or someone else, then they cannot remain in the program. And if they are discharged for not and they're required to participate. They are required to meet with our housing support workers and work towards finding permanent housing. If they are not willing to sign a participation agreement, and if they are not willing to take those steps and work with us, then they are discharged from the program. When it is an issue related to a disability, whether that's a mental health issue, a physical disability, a developmental or a cognitive disability, then we will engage with the local support services more intensely to try to help that person understand what is being asked of them in order to remain in the program, if we believe that it's a situation where they truly don't understand what we're requiring of them. So the flip side to that would be that we would put more rules or restrictions in place around the eligibility criteria for the program. And we would require that people would be at a certain level of stability, that they did not require 24-hour supports. We could put restrictions in place related to addiction issues. We could put restrictions in place related to health and mental health and even compliance with medications. That, regardless of what we choose, there are going to be unintended consequences of that. We have seen some of the unintended consequences with our low barrier program, meaning that sometimes we have people that we support that engage in behaviors in the program that have potential harm to themselves or others, including our staff, including the neighbors or other people in the community, and they are then discharged from the program. Unintended consequences of putting more restrictions in place could be that we have vulnerable people who remain unhoused and unsupported in the community. And we have more people who are on the streets, or what we call living rough, and that has impacts on themselves, on other members of the community, on some of our business owners, particularly in the downtown cores of our urban centers. So on that front, it is our recommendation that we continue to operate from housing first, trauma-informed care perspectives, that we continue to operate a lower barrier program, but we also continue to look at our safety protocols and increase those. We've already done some of that. We've got increased barriers in the office areas at our emergency housing program locations due to safety and due to COVID. So clients cannot come all the way into the office anymore. They are seen behind a plexiglass barrier. And Marlene and I were out at the location in Jarvis earlier this week and saw the work that's been done out there. We've got increased security cameras that have gone up. We are purchasing mobile, I don't want to call them tracking devices, but they are kind of tracking devices, and safety devices for our homeless prevention staff, so that when they are working out in the community, we can see where they are, in addition to having copies of their schedules in case there are safety issues. Staff really feels that the potential consequences of putting more restrictions in place on the clients has a greater risk to the community than continuing to work with our most barriered and our most vulnerable citizens. So that is that issue. The other thing that we wanted to report through this report is that we have made strides to increase our diversion efforts, and that has resulted in a slight decrease in the number of beds in emergency housing that we have needed, so reducing from 25 down to 21. Diversion meaning that people only come into emergency housing as a last resort, and we do a full assessment before they are admitted to emergency housing. We have also, and I believe that we have talked about this before, but we have also shifted to a block funding model where we essentially pay a monthly rent on the rooms at a rate that is significantly reduced from the market rate for motel rooms. And that means that those rooms are secured for our use. and we don't have to compete with the open market. Also recognizing that there are a limited number of operators within Haldeman and Norfolk who respectfully see emergency housing as part of their business model. So because of that, we want to make sure that we have a consistent number of emergency housing beds available. So with that, Mr. Chair, I would be happy to answer any questions. And again, of the two options that are presented in the report, staff are respectively requesting that we continue operating the program using option 1.
Thank you, Heidi. Questions? I have Councillor Corbett, then Councillor Patterson.
Thank you, Heidi. I deem the program that you're running now to be successful, and you highlighted it in taking the number of beds down from 25 to 21, and providing what you call a deep core support. Is this within the funding envelope and part of our parameters going forward? I'm just wondering, is that something that you can do, that you're doing to save us money?
Mr. Chair, through you to Councillor Corbett, the homeless prevention services are 100% funded through the CHIPI, which is provincial funding, and there is no municipal contribution to these programs.
Councillor Patterson.
Thanks. And through the chair, Heidi, on page 2, it's probably more of a comment maybe, but with a little bit of a question. In the middle section of the paper, I'm just wondering, we make reference to staff did an investigation 2 years ago as far as motels and it didn't meet their business model, that type of thing. I'm just wondering, because the state that we're in this year, and hotels, motels probably having whatever they have, 15, 20%, occupancy rate, has staff done it, or are they, I guess I'm going to say maybe recommend, or have they thought about going back to some of these same motels we contacted 2 years ago to see if they wanted to be part of the program? Because I think there might be an uptake that there wasn't 2 years ago. And kind of added to that, I mean, I realize we have the one location in Jarvis, which is definitely not ideal. I mean, you made reference to living rough, I guess is a nice way to put it. I mean, living in the Star Motel is definitely an upgrade to living rough, but I'm thinking as a service to the folks that need these rooms, they're really, really in isolation. I mean, we've heard earlier this year, some taxi companies are reluctant for whatever reason to go there. Even if they can go there, are the clients able to afford to go to the closest town, whether it's Simcoe or whether it's Hagersville, to get their amenities? I'm just wondering, I mean, I know it's an interim solution right now, and I guess it's our only part of the game that we have, but I think I would suggest that staff needs to maybe do a follow-up with some of these motels that we spoke to 2 years ago and see if we can get an increase in facilities. Just a suggestion.
So, Mr. Chair, through you to Councillor Patterson, certainly we have not done a market scan or an RFP or a tender to see if there are other providers that are willing to partner with us. I know that there's at least one. I know that there are times when we have people who need emergency housing in communities where we don't currently have it, and we have challenges getting motel rooms. But certainly that is something that I could ask staff to do. I think that in our emergency housing program, when someone is admitted to the program, they get a welcome kit that has a basic set of dishes. They get towels, toiletries. We do provide food and meals. We assist people to get onto social assistance if they don't have a source of income, so that they have a basic source of income. I've thought a lot about this and what would be the ideal location for an emergency housing site. And to be honest, I'm not sure what that ideal location would be, because if we moved the emergency house, sometimes there is a benefit to having some space around our program, because sometimes we support people who would have some challenges living in a highly populated neighborhood, even just for a while, until their lives get stabilized. And so when we look at, yes, at least one of the locations that we use is outside of the town limits, and so we sometimes have some transportation challenges for people, and we need to provide taxis, or we need to bring things to them because they can't get, you know, somewhere, or they walk into Jarvis, which is a long walk. The flip side to that is that if we moved emergency housing into a location where it was a populated residential neighborhood, or you know, another area, there may be some challenges. Again, respectfully speaking, with the utmost respect to the people that we support, sometimes the most vulnerable people that we have, for very understandable reasons, have very challenging behaviors. And if we move them into a neighborhood where it is a residential neighborhood, or it is a downtown neighborhood with businesses, or it is close to a school, there are going to be, I'm certain there would be concerns there as well. And again, I want to be clear that I say that with the utmost respect to the people that we support.
Thank you, Heidi. Any other questions on this report? I support the option one as well, Heidi, and I'll ask for mover and seconder for the recommendation on page 42. Mover, Councillor Taylor, seconder. Councillor Huffman. All those in favor? It is carried unanimously. So Marlene, you spoke about the budget plan, so we'll skip over 7.1 and we'll move on to page 43, which is a review of the terms of reference for the Health and Social Services Advisory Committee. Councillor Taylor, thanks for reminding us that we need to appoint a vice chair for the committee now that Councillor Roberts has bowed out. So I'll look to recommendations from the floor. Vice chair should be from Norfolk County, right, according to the terms of reference. Kind of narrows it down. Yeah, so I'll let you three fight over it. I know I can see you jumping up. Councillor Van Passen.
It's like, Mr. Chairman, since Councillor Taylor pointed out the need for it, I would assume that's like a willing call to the floor, so I would nominate Councillor Taylor.
You're bang on. Absolutely what I thought.
So Taylor, did you want to comment?
Yeah, Thursday morning is the one day of the week in which I cannot do any council-related activities. It's other than, you know, the odd budget once a year that I have to miss for that. It cannot work with the work schedule. If we were able to move the meeting to, say, a Monday, happy to do the morning, but Thursday mornings is an absolute no-go for me.
Okay, Councillor Corbett.
Well, if it doesn't have to be on a Thursday and you can attend another meeting on another day of the week, I'd like to see it go back so we could not have to break up our day such as today. I do know that we have council, committee and council on Monday, and our council meeting is at night, so Monday would be fine, something like that.
Mr. Huffman, I saw you stirring there. Did you want to make a comment? Do you have any opinion? And then over to Councillor Taylor.
No, just wondering about the time. So you're saying that you have your CICs on Monday, Tuesdays? Okay. Oh. Okay, okay. Yeah, I was having a hard time following along there. And we're looking at a 9:30 start for Mondays?
Yeah,
Just-
or whatever day we can pick.
Okay.
We're just finding that it's just top of
Yeah, yeah.
it's terrible trying to. Mondays. So I have Councillor Taylor.
I was actually just going to provide the opportunity to staff there to, because I don't know how your internal structures work when you have your meetings to prepare for these and all that kind of stuff, so.
So thank you. Through the chair, I think Mondays are fine from a staff perspective, and 9:30 are obviously fine. I think the challenge is going to be finding a consistent Monday due to holidays, so that might mess up a bit of the CIC and the council dates, but I'll look at Kristen, and I'm sure she can do some magic for us and recreate the schedule, but we will have to be cognizant because there are a substantive amount of holidays on Monday.
I may suggest then, if it falls on a holiday Monday, we just move it to the Tuesday morning and do it that way? Oh, is that a morning or is that? Oh, gotcha. Gotcha.
So may I suggest if Kristen could maybe, if everybody's agreeable to a 9:30 start, if we could look at Monday and/or Tuesday, depending on the CIC and the council committed days already, and then we'll circulate that for your review and consideration for the January, and Kristen will confirm the January meeting with you as well.
If I may, we have it, what, every third? Well, in those months where you have a holiday, you could have it the second or fourth, rather than go to the Tuesday, which might conflict with the county's CIC.
Yeah, the challenge with that is like the process for getting to advisory and council are already very lengthy, so that actually may delay by a month depending on where it lands. So if I could respectfully request that Kristen just has a quick look at it, because I would hate to delay a report yet another month because we now have gone to a different week. Because we try to have the meeting and then like within a week or so, we go to CIC so that it's processed a bit quicker. So those are just some of the potential implications, but without having an opportunity for Kristen and I to look at the schedule, we just can't speak to it, but we'd be happy to do that for committee.
Let's give staff the opportunity to do that. I have Councillor Huffman to speak, and then Councillor Patterson.
Thank you, Chair Delmonte. I just want to say, I think the only one I went through it, and it is only February, Family Day. Other than that, the rest of the year looks fine. So I just want to say that I support the Mondays, the third Monday at a 9:30 start.
Patterson?
Yeah, and just to save Kristen some looking up or whatever, that's the same thing as Councilor Huffman just said, our only conflict, and we have council at the next Tuesday night, so it's fine for the Family Day one.
Okay, thank you. Now, Marlene, there's some other changes here that have been made. Is there anything here you want to highlight or speak to?
So thank you through the chair. I'll give Kristen the credit for finding the recommendations, but there are a couple of housekeeping and COVID suggested protocols that Kristen's put in red for your consideration and review. It'll be just the date that it's the annual review. The meeting locations, keeping the options basically with live stream either here at CAB or at GAB, respectfully, and now number 10, the deputations, in keeping with the CIC deputations, we are recommending the 5 minutes versus the 10 for your approval as well. So with that, I think those are the only 3 recommended suggestions from staff, and we'll leave it with committee.
Any questions or comments on those proposed changes? None? Okay. Do you want a motion to receive this as information? Mover and seconder for that motion, moved by Councillor Corbett, second by Councillor Taylor. All those in favor? It is carried unanimously. So we'll wait for the schedule. We'll wait for you to get that schedule out to us. Page 49, Acting General Manager memo. Any questions on that memo? Pretty straightforward. Okay. Is there any other business from members of the committee? Councillor Van Passen.
Thank you, Mr. Chairman. I should have done this when we did the agenda, but this, the survey that we received from the Ag Advisory Board should have been listed as one of the communications on the agenda so that it, follows the proper paper trail. So.
Okay, I for one haven't had a chance to read it. I will. But I understand your council is dealing with this or has already dealt with this.
Yeah, well, we dealt with it on Tuesday, and but I just thought it's good background information. Maybe we've been dealing with the bunker issue a bit more in Norfolk than in Haldeman, so I thought it'd be good information for the members of the board here. So.
Right. No, I thank you for that. I appreciate it. We'll have a look at it. It was interesting to see the documentary on CBC as well. The mayor there was interviewed. That was really interesting to watch that, but I'll certainly take a read. I found that really interesting. Councillor Corbett?
Yes, if I may, I know it has significant importance to Norfolk County with the number of offshore people that you bring in. I know we deal with offshore people in Dunnville, and my interest was to get, as far as this committee, the input from our medical officer of how he feels on it. I realize in what is being put out that the Norfolk Council has some input on whether they want to waive taxes or all those types of things and how it affects your bottom line. So I'm looking at it from the perspective of what is our opinion towards it as a Health and Social Service Advisory Committee, and that would be from Medical Officer of Health. Am I right in that? And then the rest, when it comes to relief for taxation, is up to Norfolk County? Just clarification.
Marlene, did you want to comment on that?
Well, through the chair, can you just clarify your question again? Just on the taxation
If
piece.
I may, the input that you would have coming out of the Health and Social Service Advisory Committee would be the Health Board's recommendation to the Medical Officer of Health, how he feels on the questions or the proposals there. When it comes to discussion with regard to waiving of taxes, that would be within our parameter. That would be up to the Council of Norfolk. Is that what I'm reading?
Yeah, so through the chair, thank you for clarifying. I wasn't clear on the taxation piece at the end that you were asking. So yes, the opinion of the medical officer of health would be from a public health perspective as far as taxation and user fees, et cetera. That would be respectfully from a council level, not a board of health level.
Thank you.
Is there any other business from members of the committee? Okay, then we're adjourned. Thank you very much, and Merry Christmas, and to all of you, and I know 2021 is going to be a better year. Yeah, yeah. Can't be any worse. That's just I think just get something out to us. Yeah, just put something.